First, I position a chair for a parent to sit on in a way that gives me enough space to move around it, while maintaining optimal scanning distance. Each 3D scanner has a certain range where it produces the best scanning results. So the distance you'll need to keep will vary depending on your 3D scanner. I always sit the baby on the knee of the parent facing forward, having the parent hold the baby under the armpits while slightly stretching down the collar of the shirt. Next, I use a piece of tights, tie them off and gently put them over the child's head so that it flattens the hair. This is especially important if you have a child with lots of hair, but I do it basically all the time. Hereby, the ears should not be covered, as this will improve your 3D scanner's tracking capabilities and will help us to position the orthosis trimline more accurately. A loosely fitting cap, like this one, is not recommended, as it captures the upper part of the head less precisely. Haptic tracking points, like these ones, which are just pieces of padding with double-sided adhesive tape, can improve your 3D scanner's tracking capabilities or simplify the 3D scan merging process if post-scanning merging is required by your 3D scanner. Now we're all set, so let me show you how I take 3D scans for my cranial remolding therapies. Personally, I scan each baby along the same 3 scanning routes. The first one starts at the back of the head, along the left side and to the face. Then I reposition the baby to the right. Second one starts at the right side, goes along the back and the left side, and ends at the baby's face. Then I reposition the baby back to its initial placement, facing forward. The third and last one starts at the back, along the right side, and ends at the face. Now that I explained the general process, let's take a look at how I do the 3D scanning in action. First, I always recommend having a second person distract the child from the front. Now I'm going to take the first of the 3 mentioned 3D scans, starting at the back of the head. You can see me move along the left side and to the front, into the child's vision. It's important to always start outside of the child's vision and move into it, because if I were to do it the other way around, the child will likely follow me, which will make it more difficult to capture the neck. And here is a tip. Notice how I begin scanning on one end of my planned path and finish at the other end? This is the recommended way to take your 3D scans. The disadvantageous way is to start in the middle of your planned path. I would have to first move to the back, then switch directions and move back to the face, which results in you scanning the middle area twice. This can cause more artifacts, lower scan quality, and as the process takes longer, it gives the child more time to do some jerky random head movement which can mess up your scan. Furthermore, when scanning, you should try to capture lots of area relatively quickly, moving the scanner up and down without making jerky movements. There is no need to focus the scanner on the same area for several seconds. In the contrary, the number of undesired artifacts is likely even going to increase the longer you scan the same area. Accurately capturing the neck area is especially important for the first scan, from which we will create the custom orthosis after you provide it to us when purchasing your custom orthosis from our website. Now that I have finished my first scan, my colleague switches positions and I rotate the child 90 degrees to the right. This will allow me to more easily take my second scan, where I aim on capturing the right side, the back, the left side, and if everything works well, also the front. Many 3D scanners, such as this Artec Eva or the Einstar 3D scanner, have a pause function, which should be used to pause the scan when repositioning the child. After I'm done with the second scan, I reposition the child to the front, as it was sitting in the beginning, and switch to the right side. My colleague moves back to the front, and now it's time for the third 3D scan, where I'm going to capture the back, the right side, and the front. Once this is done, I have safely captured the entire head. And once you have done so with your patient, you can export it as an STL file, upload it on our website, select a color, enter the patient details, and place your order. A therapy report document will be automatically provided, and your custom 3D printed baby helmet shell will be delivered in 8 to 10 working days.